have the distinct pleasure this morning of being your moderator and in being in conversation with Mr. Krishna Gautam from Aging Nepal. Mr. Gautam started his career with a focus on economics, working as an agriculture specialist, senior agricultural economist, and independent consultant leading the development and necessary training for a wide variety of programs and projects, supported by agencies such as USAID, the World Bank, and UNDP. It was Mr. Gautam's personal experience and challenges in ensuring adequate care for his father that propelled him into the field of aging and towards the development of Aging Nepal, which he founded in 2011. In his role as founder and chairperson, Mr. Gautam has risen as a dedicated and influential thought leader in the field, attending various international events such as the Open-Ended Working Group on Aging, as well as a variety of training and conferences throughout Nepal, Australia, Thailand, and Sri Lanka. He has published more than 7 books and booklets on aging issues and was also involved in the 2012 review of the Madrid International Plan of Action on Aging. Today, we look forward to hearing more from Mr. Gautam on his advocacy work towards prioritizing aging in Nepal, including the challenges and barriers in his work, as well as some of the innovative approaches that he has developed to advance advocacy efforts in the region. Mr. Gautam, thank you so much for joining us today. I thought we could start this discussion at the beginning of your journey. You've had quite a unique career path, and I know that you've shared a little bit already, but I wonder whether you could share a little bit more about how you became interested in aging and the motivation behind the establishment of Aging Nepal.
Thank you. Motivation. Motivation has been the dementia of my father, because when I first faced it as a caregiver to my father, I looked for help around in Nepal and couldn't find any. There is no geriatrician, there is no geriatric nurses, there is nobody knew about the problem of my father that I was facing as a caregiver, So that really made me, I have been working in agriculture economics, rural development and all that. But this is the thing where I'm really faced with problem of my father, and cannot one father, and there is no one in Nepal to help me, to give more knowledge, to do things so that I could keep my fathers happy. So I thought, my God, it is my problem, but it could be the problem of anyone in Nepal or anyone in the world. So I thought, okay, this is the area I have to work. And that was 2011. My father passed on 2013, but the problem I was facing from quite a long time before. Then I think this is the right thing to do. And I'm happy that, it is the right thing to do, because it gives 4 things. It gives self-satisfaction, that your life has been useful for others and the coming generation. And I'm very satisfied and lucky man. It's my luck that pushed me here, thanks to my father and his dementia. Should we start with the session?
Yes, Lee, I think that's an interesting way to look at it as luck, Dr. Gautam. I think it's kind of that glass half full, that you've taken something, that line of light through the cloud there. So I love that approach. I wonder if you could give me a bit of a snapshot in general on aging in Nepal, and speak to some of the cultural factors that impact and intersect with the issues of aging.
See, okay, but that was my father pushed me in, or the dementia of my father pushed me in this area, and I'm very happy, very satisfied that thankful to him and dementia that he did it. See, let me familiarize with the present situation of Nepal. Nepal is a small country. It is not a small, it's a big country, but because it is located between big China and big India, so it looks small. Otherwise, it is quite a big country of 30 million people. And now our older persons, our constitution defines 60 plus age people as older person. So from that definition, which I think is very old now, it's not valid anymore. 60 plus age is not an old, it is just mature. But that's my personal opinion. And in many countries, I think this definition of older person doesn't justify that 60 plus age. And maybe the time will come when we'll go to further higher age of 65 or 70. Anyway, so we have 10.2 to be exact. We had census in 2000 21 and 2021. And on that census, it says about 10.21%. Generally, it is when older person population goes above 10%, then the nation as a whole or the society as a whole start feeling the heat. If it is below 10%, if everybody is comfortable, everybody can contribute and take that. So we have 10.21% of older person in the total population of 30 million, and they are growing at the rate of 3.15%. 3.51%, whereas our population growth rate is only 1.3. So our older persons are growing 3 times more faster than the population itself. So it has given to so this population change demands changes in many fronts. Like it changes in our culture, tradition. Like traditionally, our children, the children are supposed to take care of their parents. That is our social values. Now, because of this, that is when we were agrarian economy or agrarian society. Now we are no more an agrarian society. Now the son may be in Japan and daughter may be working in Canada, and the older parents are in the home. So this whole perspective that all older people are taken care of by their children doesn't hold anymore. So the culture had changed, the social value system had changed. Older people are not as much valued these days as they used to be valued in our in our tradition or culture or society. So the changes in population and the typical characteristics of this older population as such requires many changes in our society. And these changes we have been trying, I think, all over the world. We have been trying by doing awareness building. We call it very awareness building. So, like, in our culture, this was inbuilt in our society, in Nepali society or Nepali culture. I think in most of the societies, that we used to get lesson in our primary school. It says, take your mother as goddess, take your father as the god. And similar lessons we used to learn in a primary schools. And the learning of that age really affects, even in my home, before we take food, we had to go to the father. The father used to be, served first. So father used to come first every time. Now it's no more. When you are go to McDonald's and other things, there is no who is served first. So of all the changes, what I see, another problem we have added is, as a poor country of Asia, our children, our youth are going out migrate for education or for job or anything. At now, almost 50% households in Nepal, at least one person has gone out of the country or out of their nest to leaving their older parents back in the village. Nepal is basically rural area, and most of the older person live in rural area. And rural area means not enough road, not modern amenities, not good hospitals, many difficulties, especially when this country is a hilly country. So 50% of the population live in hilly area, where if you want to get out of your house, either you have to climb up or get down, and both requires good use of your knees. And old age is such an age, it first attacks you. If you want to know whether you are old or not, just look at your knees. Does it say something to you?
So Mr. Gautam, I want to come back to a few points that you've already raised, because I'd like to deep dive in a couple of them. You've talked about, I think, a general lack of kind of awareness and prioritization of aging in Nepal. I think, and that's due to a variety of reasons, one of which is just that there's a lot of competing priorities, like I'm sure in many low and middle income countries. And then there's the issue of kind of migration and families kind of leaving the traditional home and how that's impacted culture. So I'm wondering if you can kind of talk more specifically about a few of those issues, and more appropriately, kind of some of the strategies and innovations you've developed to kind of help tackle some of those issues. So how have you helped to raise awareness? How have you helped to kind of deal with the lack of traditional support?
Thank you. It's a very important question for me, because this is what I used to say to my friends. You know, we people who are working on aging issues, we always wait for International Older People's Day or World Elder Abuse Day to say something and something good for that on that day about the older people. What I have done, that we say, we take out procession, we write articles, we shout in radio, in TV on every special day, be it World Earth Day, be it World Climate Day, be it World Literacy Day, any day. So don't, older people's issues should be raised not only on certain days of a year, it should be raised every year and every time. And that's one thing. And second thing we do is, what I believe, by the way, me being the poet myself, poetry is very important. It has very deep effect on the larger mass. So we have started elder literary groups in different districts. So all we do in that group is we look for some already known writers and ask them to please write an article on older people. Please write a story on older people. Please write a beautiful song about older people. Please, any people of any age can write this elder literature. It doesn't mean only elders have to write it. Anyone can write it. This is creative writing. But the topic or the subject should be about the older people and their emotions and their life and their feelings. So that is one new thing that Aging Nepal did. Previously, when I started in 2011, there were very few radio, TV, or the songs and even jokes, all this creative writing. There used to be none. And now we have many every day. I get around 20 to 30 either poems or short stories, which really pinches you and say, hey, think about your elders, and especially you, when you get old, think of it, that type of thing that we are doing for this awareness building. And it's a continuous process for us. It is not only for a particular day, Elder Abuse Day or International Older Persons Day. That's one thing we are doing. And it has changed. It has made some change. So awareness should be also another thing is what is awareness? Awareness means changing people's information system in their head so that they behave differently towards the older people. And we have also tried to include curricula in the high school system, where they learn about older people, their issue. And if you learn, what I find is what I learned at the school level, I still remember them. and my behavior is affected by what I learned at the school level. And as the higher education also is important, but start learning and people or children to think about the older issues of older people from their very beginning. As I said, I think previously I said that in our tradition, we used to teach our children to respect father as, I think, all religion, all mythology. There are many stories and songs that basically comes from religion. It says that your parents are important. Like even in Christianity, I think somewhere I read in Bible that if you do not serve your elder parents, you are not a good Christian. like same thing with the Islam books, and it's the same thing with the Buddhist thing. So all religion. So what I've done is, which I'm proud of and I would like to share with you, that I read all that Bible, Quran, Dhammapada of Buddhist, Tripitaka, all these main religion of the world, and they have all these religious books have their they say how important are the older people and how important that we respect the older people, not like Hindus
I think,
maybe.
Mr. Gautam, you're tapping into people's kind of, recognizing kind of the cultural influence
Yes,
that religion has,
yes,
especially in
yes.
certain regions, and
Yeah,
being able to kind of
yeah,
leverage that for
yeah.
purposes of education
Yeah,
and
well, which they already have. Like if you are a Christian, if you are a Muslim, if you are Buddhist, doesn't matter what religion you are. But if you take out all the good things that these holy books have said about older people and their importance and your duty as a younger person towards the older person, and I have got them together and prepared a book that, of all those sayings and wrote it in a language. We know there are something say Buddhism. If it is written in Pali language, which is the original language when the Buddhism came, so you write that in that language so that people believe it more. They have faith on what is said in Pali language. Like in Islam, if you can understand, you can get translation in the present context, in present language, in English or even Urdu. But if you write in Arabic language, that the original language when it was first written. So I have written those things, prepared small books, and people really read it. Yeah, it is said in the holy book, so we have to do it. We have to do it.
So, Mr. Gautam,
I,
before you continue, you've raised a couple of really important issues, and I want to make sure that I'm capturing them. I think one of them is what you've just said, which is kind of the issue of language. I'd love to know kind of, how, kind of the diversity of language within Nepal and how that has factored into your work. Obviously, kind of translation and making information accessible in a variety of languages is really important. And I'm wondering, again, I think in a lot of countries, that's a nuance that often gets forgotten. I think resources and educational materials are presented typically in one or two languages, maybe if we're lucky.
yes,
Often.
yes.
And oftentimes that really excludes a number of populations, particularly marginalized populations often. So I wonder whether you could speak a little bit to that. And then I have another follow-up question for you.
Oh my God. Okay. Thank you. How come you always ask so important question?
I try.
Like, yeah, in Nepal, there are many tribes, and it is, I think, more than 120 tribes. They have their own language, but our national language is Nepali. Nepali is national language, and almost it is readable. So everything will not be available to every person in Nepal in their mother tongue. So they have to come to the national language, and we are also not that powerful now that we can create for all people for all the language. So if we get Nepali language, that is we get most of the people covered. And behavior is also what you call it moves from one person to another. If I behave certain way and you are my neighbor, we learn from each other. So it's so we have not been able to address to the mother tongue issue for learning, but the national language or the official language where most of the people do that, most Nepali. And then the language of faith, as I was talking earlier, when a Buddhist sees some writing in Pali language, the original language, or the Islamic people see their something written in Arabic, they attached at least the traditional value to it. So for our, it is the Sanskrit. If it is Sanskrit, people say, oh, it is written in the holy language, so must be good about it. So we must follow about it. So we already, what I try to do, or what we try to do in Nepal is start from what people already have. What people already have faith and what they already know, and build on to it about the older people and the issue that we would like to promote. That's what we are doing. But as you say, yeah, it would be nice if we can, do it, we give in the mother tongue, but
absolutely.
we have not been able to do so. Maybe in some time, hey, my children have to get a job too. So live them. That's all.
So, Mr. Gautam, the other thing you've touched on is the idea of kind of, you've kind of have a two-pronged approach to awareness raising. I think interestingly, you've kind of you've talked a little bit about kind of the power of storytelling and kind of the catalyzing kind of voice and engagement of older adults. And then there's that education piece. I wonder if you could speak a little bit to kind of like how you develop that strategy and how how those approaches are different and kind of the extent of the curriculum potentially. I know you touched a little bit about kind of the kind to a kind of faith-based and the power that can have, but a little bit more about the scope of kind of what an education curriculum would look like.
Oh, see, there was no curricula included this gerontology and geriatrics. So whatever we did was the first time, and that was easy for us. Maybe it will go on improving as the time goes on. If I understood you correctly, the strategy is, again, go for what people like. For example, songs. Love songs, and there are many types of songs. These songs people like to sing if they want to enjoy or feel good. They sing certain type of song, and if they are sad, they sing certain type of songs. These songs let them express their whatever they are feeling. One of the major issues that I find among older person is they don't find the way to express their feeling. The most of the songs are for the younger generation or the younger people. I love you, I love you, I love you type of thing. But there are other types of feelings that the older people get, and they don't get expression to it. So I say, or we see in Nepal or aging Nepal, what could be the give them all the this literary work like songs, drama, TV, radio, all these written media already, and plus books, and these introducing curricula in the high school level and the master level, university level, is a recent phenomenon. It started only about 3 years back. It took a lot of my work, but I'm happy that it is going on. The government has accepted, and now in the government approved curricular system, there is even this much is there. And I think the coming generation will be more already informed about older people than when they come to the workplace. Like they could be the minister, or they could be prime minister, or they could be the worker. At all stages of the coming generation will behave. I expect them to behave differently. In their working age when they join the labor market than what we are seeing today. So the strategy is simple: get the people, touch the heart of the people.
Bring the people what they want.
Yeah, and tell what they want, and already built on what they already like in any country, there are some religious people, they have a strong faith on their religion. So okay, I'll go with your religion.
Yeah.
And I'll build into it.
Those entry points, right?
Yeah, and there is the tradition of songs. There are particular group of people who are a tribe. They have particular songs. Okay, let's build into the song. So that's what we are going. Anywhere, any room I get, I enter and say, hey, talk about the older people and their issues.
That's great, Mr. Gautam. I've got a great question here from Catherine Klein, who's with us every week at the Global Cafe. Catherine, would you like to come forward and ask your question?
Sure. And Krishna, big welcome from New York City. We miss you here.
Nice to see you.
As everyone can tell, you are a fabulous advocate. I asked you to share because I think it shows how you incrementally change lives. The little bit of a grant that we were able to offer you a number of years ago to pilot literacy for older adults in Nepal who, being illiterate, were really isolated and left out. And I think the story shows not only how they gained self-respect and influence in their families, but how these, and you can tell more of the story briefly, how it also changed their lives because the people who stayed in the classes, and you tell us who they were, ended
Yeah.
up becoming a group by themselves. So it wasn't just the knowledge that they gained, but it was the connections. So tell
Yes.
us your story. It's a wonderful
Oh,
one. And continue and tell us how you built from that.
thank you. Thank you. You know, it is just when you are doing things, some good things just happen. At the UN, there was $3,000 something, there was, is anyone interested to work on older people about the on literacy? So when I saw that fund and I did that, what I see in Nepal, even now, more than 90% of older women particularly are illiterate, even now, illiterate. When you are illiterate means you cannot go anywhere. People will ask very easily, please sign your name, please write your name, or go to the 12th street, or if you are illiterate, all those things doesn't make any sense. So I was contemplating on all this and what we can do about it. Then suddenly I got that funding, and thank you for all that. Then we started giving them all this basic A, B, C, D type of thing in our language, and little bit numeracy, and also a little bit of using new gadgets, simple gadgets like household things and the computer and mobile. But first year we did, and then we failed very miserably, because after 10 months of the class, they were at the same place where they started. Then luckily, we got one professor, Professor Abadji, who came from nowhere, from the sky, maybe God sent. She came and she said, hey, you don't know how to teach older people. You have to follow a different method. And she guided us how to transfer knowledge and how to equip older people with literacy and numeracy. We followed that, and we did very good on the first year and second year and third year. And with every year we learned something and we improved on it to see which is more effective. And by the fourth year, we thought, oh, now we know how their brain works when it comes to learning. And exactly at that time, we were selected for even UNESCO Literacy Prize. So it's a great satisfaction. But that is a costly thing. Running literacy class for older people, and it is not about basic literacy of ABCD. Also literacy on digital literacy, health literacy, financial literacy, all those so many literacy things have come up. And older people, they are left behind. They were left behind by us, or we development worker. We think we are in present. We are leaving them behind because we are not providing them the opportunity to learn whatever the new thing they want to learn. And because if you are not aware, not regular with these new technologies that are coming every day, new gadgets, new things that make your life easy. But yes, it makes your life easy. Does it make easy for your parents and grandparents? And we in our education system, we lack. We don't ask that question. If it works for me, I'm a young guy, I can work it, and that's fine. My father doesn't need to know. My grandmother doesn't need to know. So that education, as we call it, lifelong learning. So we are still trying to build into the national education system where older people are also given room, institution, organization, process, and everything, and plus, of course, the budget to all older people, accessible to all older people, that they can learn and be in par with the present day society.
If I could, Krishna, just because I know there are other people with questions, two quick things to add because it related to the issue of language, is that the professor in Texas who studies how older persons' brains are, and that's what you referred to, also was the first person to create a curriculum in a local dialect. And that's the first thing. The second thing is, it was fascinating to me, and I don't know if it's still true, that mostly the older women stayed together and the men had much more difficulty accepting that they weren't in charge. They might have not been as good learners as some of the women. And third, you have expanded it with additional funding, I believe, with Switzerland and the government, to many other locations. So it left being a pilot to being a model. And I just wanted the group to know your efforts, because they're fantastic.
Yeah, it's but this, about illiteracy, what we see is the males are a little bit more literate. I mean, more percentage of male are literate than the woman, because about 60 years back, when they were kids, the present day older women were kids then. There were not as many schools, and there were many social taboo against girl education, and so many other taboos. But this has to change. This has to change. We have proved, and we're doing it every year. Now it's not only the education. Another fallout, or another side product is they get friends. They get close friends. If you are taking class every day, 3 hours or 4 hours, meeting the same person for 10 months, then you become so close a friend. I'll tell you one very two very touching things. When one lady, she didn't come to the class for 2 days, so we whole class went to her house just to see, how she's doing. She was falling. She was feeling sick. She had fever and all that. That class visit to her home was such a wonderful moment. She cried of happiness and all our tears, because from there on, she was treated differently in the house, because she's not a single old lady. She has 30 older friends, and they can come home anytime if she is not behaved well, so too. And second thing is, now they have, everybody want to express, everybody want to friend, like when even your own children, they do not play with you, they play with neighbors' children. They go to that's the tendency. So these older people, when see another older people, they can express things, their problem, and it's a common thing, and they know each other, they're helping. So that group, formation of a group itself has very important value. I'll add on to it that I talked to the government about it. I see the formation of the government about this Helpage International work on it for many years, like older people association, older people group, and all that. So we also saw the value of it from this literacy class. Then I went to the Prime Minister actually and said, look, this is what it is going. And old man, he was old man also as a Prime Minister. You got to get some A's to be a Prime Minister. And when I said, please, we need group of older people all over the nation. And he said, yes, and done. Now I'm happy to report you that in Nepal, all ward is the smallest unit of the government. Right? We have older people's group in each ward of the country. So that is a really great achievement, I feel. Now they can decide for themselves. So the government also gives them some money every year, and they can do whatever they like with that money. So slowly we are moving in the right direction. We didn't have group all over Nepal. We were forming by some project in some, like we are doing with literacy in some communities here and there. Now it is all over the nation.
So, Mr. Gautam, I know you've touched on, I think I've heard Catherine and you both touched on it now, the kind of the role of government. And I know obviously this pilot project was a fairly influential and allowed you to kind of make some headway within government. So I wonder whether you could speak a bit about, what that process looked like, and how kind of what has been the change in the government's approach and support of aging issues in Nepal since some of these programs have kind of come to be.
Yeah. Okay. The process about the class. all, one of the this out migration from villages. Most of the older people in Nepal, I think, in most of the developing country, they live in rural area and their children in the urban area. So when they in urban area, they earn some money or do some good work, and then they call older people from the village to live with them in the urban area with them, right? So that makes the older person very difficult to adjust to the urban society. Particularly, like, you don't see signboards, signboards and street signs in rural area. But in urban area, there is number and read and signboard. So it's totally starting from daily habits too, and they have their friends too. They don't have friends in urban area when they come from the rural area. So we selected some newly developing areas of Kathmandu, and we visited each house where older people lived, if the family had an older person, and asked them whether she's literate or illiterate, and we were made fun of it. I'm about to die. Why do you want to teach me? Type of thing, right? I'm waiting for my death. And the same lady, when we convinced her family and gave her one year class, then at the end of the class, end of the session, I asked her, "Okay, lady, what do you want to do?" She said, "I would like to I want to pass the high school grade." I mean, the lady who first said, I'm waiting for my death at this age, and now says she wants to finish the high school. So that type of aspiration, that type of confidence. And one day I was in the class, and it was World Elder Abuse Day. They said, "Sir, it is Elder Abuse Day. Let's go and make a protest. Let's make a street rally." I said, "Why want to do that?" Say, "Now we are educated. Now we take the issue and go to the street." I mean, it was so
Great ripple
satisfying.
effects.
Yeah, and it is now in some of the, not all, some of the ward or some of the village council have started running this class by themselves, by their own funding. Previously, we looked for funding from outside, outside Nepal, some INGO and some units of UN, but now it's going on. The fire is catching. The fire is already in there. It's catching. Yeah, but you have to wait for it.
There's a great question, Dr. Gautam. It's a bit of a change in track, but I think it's a fantastic question. So from Mark Venning. Mark, would you like to come forward and ask your question?
Yes, I'm switching the stream here a little bit.
Yes.
That's okay, I hope. Can you describe the continuum of the home and healthcare system for older people in Nepal? Looking at rural versus urban, and all that. How does it work?
That's very sensitive area. We are working. Our government is very good in the sense that they do write good policies, but they don't implement it. I think that's true with many of these developing countries, characteristic. Okay, when we first started in 2011, there was no gerontology or geriatric doctor in Nepal. Now we have 5. Though they have done by themselves. There was no training for the caregiver training, no nurse training. Now we have given them training, and we give them that is a costly program. And when we get support, we already did 2 or 3 nurse training for the elder care, and also the young youth who are unemployed or who are low or just high school graduates, low in education. We give caregiver training. So the first thing is, we didn't have human resource. Now we have some. Okay, that's one of the progress. But the government was not involved there in the beginning. Now the government itself provides it has developed a curricula, and it provides training for the caregiver. That's second progress. And third is it has made many policies and health programs, and we are still working on it. Our policies are changing every day, and this week also we are drafting. The government soon will come out with a new policy that has many positive thing about the health of the older people. About the rural and urban area, Nepal's rural area Nepal is a poor country, so rural area is really poor in modern amenities. They are not functional hospitals. There are not geriatric doctors, not even good medicines. At least we are happy at the stage that at least government has started putting its money for the health trainer, health worker, for geriatrics. That's one progress I see. A lot has to be done. And second thing, we didn't have anything like a geriatric department or a geriatric hospital or anything like that. But now, I think it was 2013 or 14, we really, it also depends on being in the poor country. One of the advantages of being in poor countries, poorly ruled and of higher age like me of 70, so many people, you even know politicians and big bosses. So now the government said, no, we cannot start a new university or department on geriatrics. I said, okay, no need. Let's create a unit in every hospital about geriatric unit, like we have children unit or all that, or other units, different like many special disease unit. Let's create like that. Now we have 60 hospitals in Nepal. The hospitals are run by the government. 60 government hospitals have geriatric ward. So at least the government is thinking and have done, and they have put money on it. But we still do not have enough geriatrician doctors. We have not enough geriatric nurses. There is human resource scarcity, but it is created. And now I think it will be easier for us to push the government to go for, training more people on geriatrics and creating geriatric hospital for Nepal itself. So we are moving on that direction, but it's slow.
Thanks, Mr. Gautam. I just dovetail off of Mark's question, or just more actually draw attention to the last part a little bit more. You've talked about how, again, great success on kind of integrating geriatric units within hospitals. Are those hospitals typically located in kind of more urban centers, and kind of what are some of the challenges, and how does care reach kind of individuals who live in rural communities?
Yes. See, the thing is, Nepal, almost it is urbanizing, I think, to 20% every year, or all people are rural area are drawn to the urban centers, and new urban centers are coming up. That's a general phenomena. In rural area, we don't have, even in urban area, we didn't have something called geriatric unit even in the urban area. So we can imagine that in the more urban rural area, in more difficult terrains, there are none. Still there are not. But these 60 hospitals, government hospitals that I mentioned, they are spread all over Nepal, mostly around semi-urban, I would say, not rural, but not urban, but semi-urban areas. And yes, it's covering larger area and larger people, but there are still people who are left behind with all these facilities that we just talked about.
Thanks so much, Mr. Gautam. A question here from Shmuel, who joins us every week. And apologies, I missed a key component of it earlier, Shmuel. But to what degree are kind of the authorities and government in Nepal supporting kind of social, economic, but also the mental well-being of older adults?
Yes, when it comes to government, I'm not a very good man to talk about good things about the government. Sometimes they are good, sometimes, sometimes,
We all have our
yeah,
qualms with government.
yeah, something I don't want to say. Uh, Sorry, but I lost the point there. You
Oh,
asked
just
me
how
about.
how is the government currently supporting the social, economic, and mental well-being of older persons in the country?
Yes. Uh, in our government system, this older people issues is looked over by one ministry. It's called uh, Social Welfare and Older People Ministry. There are no experts in that ministry. There, it is not well equipped with proper human resources and many things else. Okay, so anyway, this is one ministry, and health, it is another ministry. Apparently, we are interested in both older people and the health together. So we have to run between these two ministries, and they have their own priority. Yeah, that is the government system, and we are working on it. And it is very fair to say that the health ministry is doing more for the older people than the ministry itself, who is supposed to look after the social and economic and other things, which is the special ministry for the older people. About the mental health, it has always been a subject of neglect in the health science. It seems, we have many hospitals, but we have no mental hospitals. Okay, many hospitals on orthopedics and all of those things. So slowly, with the social work, with our slowly education system, they have built in the psychology. Many people are coming up from the university. They are in they are what they call it, clinical psychology, master in clinical psychology. So slowly it's coming. Slowly we have more human resources than we used to have to see the older people and their mental health. But yes, not much progress on it, except that more human resources we have, and now we can do if we get the proper attention of the government. And by the way, sometimes our government also does very good, that now they are interested. They are looking for the opportunity and ways to help older people with their mental issues. For their issues of elder abuse, issues of their depression, issues of their, many other mental issues, which is also very directly related with the physical health.
Absolutely.
So mental and physical health are very slowly that. At least we are happy that at least the government has started talking about it. They realize there is need.
Yeah. First step, right?
Yeah, it's one step in the right side. Yeah,
absolutely. So, Mr. Gautam, I want to come back to you because you've talked a little bit about some of the trainings that have been developed as part of for Aging Nepal, and I know that you also had a history in kind of the development of programs and training in your previous life as in kind of agriculture and as an economist. So I'm wondering kind of what lessons you took from your expertise with training into kind of training for whether it's geriatricians or healthcare professionals or even older adults themselves, and kind of what are some best practices in training?
You give me right opportunity to boast about my experience.
Boast away.
Yeah, like I was a good trainer. Training was my profession. Starting from my very first job as an assistant lecturer. That was my first job, which is almost like training. Then in my development as an agricultural economist and rural development worker, also I did much of training in China and India and many other countries. All that experience, when I brought into this aging issues, everybody applauded. My God, Krishna, you know much. You are very effective on that training. I said, no, I'm not effective. It is long time back. I'm borrowing the experience I had from other sector. So one thing, which I take very pride is now even the government, our government, has agreed and convinced that training is important for to take care of the older people. But I have yet another work to be done, is also think of training older people. There is a phrase, train and retain them. Like I'm 60 years old and retired, but I can be trained, and I can be trained in agriculture. I can be trained in some other professional like carpentry or anything. So what we are advocating with the government is that whatever development program you have, you have road system, you have communication system, you have agriculture system, you have education system. In all such systems, older people needs to be trained. Take whatever, you select the right older people in right health and mobilize them in those areas. That will be cheaper for you and effective for operation. That is the advocacy we are doing. Let's see. And yes, and older people not only need training for some other people to take care of them, train the youth to take care of older people. No, older people will be trained on agriculture. Like I had agriculture background, and after 20 years of not working in that area, maybe I'm left behind now. Now I'm still healthy at 70. Please give me training on the new technology, and I can be active with my previous background. Use knowledge and skill of older people. Every society, that has been our emphasis. Use the knowledge and skills of the older people that you have. If we don't, we are losing the knowledge of the society. That means if you can lose money, you can earn back. But if you lose the knowledge, it takes long years to get that type of knowledge and experience. Yeah, it's good that we are at this stage of talking with the government, and the government is listening to us. It is a great achievement to make the government listen to new idea.
It's a challenge that I think many of us try to accomplish on a regular basis.
Yeah, so at least we are very happy and appreciate the government being so open to our ideas and opinions. And yeah, we are running well.
Fantastic. Mr. Gautam, I want to come back to a kind of comment that Catherine actually made around a professor who had a kind of a knowledge on how to kind of the minds of older people work and how to kind of best approach education and training activities. How has that insight affected how you approach training with this specific population? Is there any differences in terms of the strategies for how you would approach the development of a training program specifically for older adults?
Yes. But the first year of the program we failed because we didn't know about that. Thanks to Helen Abaji, Professor Helen Abaji, who taught us that. Yes, it simply requires more repetition, because the memory is very difficult. In childhood, you say something bad to a boy and he remembers for a week or for a month. But for older people, the memory to relate the later or the world with the things that they do or that they have been living on. So it is more experiential approach. The experience they have already got. The teaching should be based on experience you already have, and translate that into words and letters and numbers and practices. So you have to build from the older person that they already know. So the approach is different. It's different. I say very rudely, for a child education, you can even maybe sometime you can say some bad words to the child. Hey, naughty boy, But these grandparents and grandmoms, I cannot say that. They have to be addressed very, respectfully. So things are, teaching youth or child is a lot easier than making the older people learn new things. Because first I have to dig out what they already know. With children, we know that they don't know anything. So it's different.
Well, we are, as always, have very quickly approached the hour. I want to give you a couple minutes, Dr. Gautam, to just kind of gather some thoughts and some key takeaways for us. And in the meantime, we're excited to say that next week's Global Cafe, we won't actually be live, but we are providing an exciting sneak peek of a Global Cafe that's actually taking place at our global conference in Bangkok. And that is with Dr. Mark Lashman, and he is talking about reclaiming the rights to live with dignity. And that'll be moderated by Seth Ginsburg, who's the co-founder and chairman from Global Healthy Living Foundation. So a very exciting session, and it really kind of a little bit of a sneak into the conference in Bangkok for those that will not be able to kind of join us in person for that. So we hope that you'll be able to kind of click that link next time. We won't gather the way we are today, but you'll have access to a kind of a little side door into our conference, which we're really excited to share with all of you. So really looking forward to seeing you or having you join us virtually for the conference next week.
Doesn't matter.
And in the meantime, I'll hand things back over to Mr. Gautam for some key takeaways and closing remarks. Mr. Gautam?
Okay. Yeah. Thank you. Thank you for this opportunity. I don't know how much is take away or take in. What we missed in this presentation today is the importance of research. Research, as the lack of research, we don't have enough data. So most of the planning that I see of many countries are not based on, data-based planning. So research is the most, and research is a costly thing, and nobody is putting money on it. Neither government, everybody is just trying to hold a old person and love it. Oh, you are a great old person. No, but the research aspect of aging, I think that is a very important thing, and so that we can move in the right direction for the longer term with more confidence that will be correct. And second thing I would like to suggest is, money speaks. In the aging issues, there is not enough fund for research and all these things. There is enough there may be some enough for conference and all that, but larger than at least national level research and continuous efforts on different issues of research is very important, and that has to be done. And we Aging Nepal, we are doing in whatever way we can. So one is the research that would require the world community to support. And second thing is who has the money. Money speaks, like World Bank, Asian Development Bank, African Development Bank, or all these banks who lend money to the developing country for to support their development efforts. If they say, okay, Mr. X country, I will loan you $10 million, but 1% it must go for the older people. That type of condition. If these funding agencies, the international funding agencies or donor agencies, sometimes they even fund countries on a grant basis. Okay, so if those if you can get the World Bank or the financial institution to support or make any nation to support their older persons, and I think that will be a great event that will change our culture of respecting older people again, and not respecting just because of the age, the respect for their experience and their value of this maturity. So that's what I would like to emphasize on. Yeah, we need money in this area. We need money.
Absolutely.
Yeah.
Fantastic. Well, thank you so much, Dr. You left us with some great food for thought there. And we really appreciate your time and expertise. It's been a wonderful session as always. Thank you everyone for joining us today. And we very much look forward to welcoming you next week. Thanks so much and have a great weekend, everybody.